Harreveld, and I'm sure I just messed up that pronunciation. But we're going to call him Dr. Phil because that will be a lot easier for me for this event. And I'm so excited to dive into this topic. We received so many questions in advance and so much enthusiasm about covering the topic of equine emergencies. And Phil, thank you so much for joining us. We really appreciate you sharing your expertise with us.
Oh, you're welcome. I'm excited to be here with you guys. Sounds like you're doing some neat stuff with this website, and I'm excited to participate.
Wonderful. Well, let's start by learning a bit about you before kind of diving right into the topic of equine emergencies. Do you mind just starting by telling us kind of a bit about your background and what led you to specialize in equine emergencies and kind of equine surgery?
I sort of had a funny path coming here. I have a Dutch family, but I was born in Brazil and raised in Brazil. So I usually tell people, I'm Dutch by blood and Brazilian by heart. And then I started with vet school in Brazil, but always had a passion because we had horses at home to get into the field of equine surgery. And then there weren't really any programs back in the day in Brazil. So I tried to pursue some different avenues, and that led me to transferring into the sophomore class at North Carolina State University. They actually allowed me in. So I went to school there, got my DVM degree there. And then I went on for 4 years to Kansas State University, where I did an internship in equine medicine and surgery. I did a surgical residency in equine surgery. And I also got a master's degree in clinical sciences with an emphasis on equine orthopedics. So it was sort of a crooked road. And then after graduating, then my wife and I, who's a small animal vet, moved to Vermont, started our own practice over there. And I had an equine practice with a surgical referral facility and also trucks on the road going to horse farms. And we did that for 22 years until I recently sold it to my associates, moved back to North Carolina with my wife and the kids. And now I work for Merck Animal Health, where I am one of the professional services veterinarians.
Wow, your expertise is so impressive, and just the amount of experience that you've had in this field is amazing. And then pair that with your wife being a small animal vet. You guys are just like, you have all the bases covered. So yes. I would love to be your neighbor. When working in Vermont, were you primarily in the field or in the hospital?
So I think that a lot of surgeons like to stay in the hospital. They have the full schedules, but I always sort of had a passion to going in the field and seeing clients as well. So very often I would do surgeries in the morning, and then after the surgeries were done, then have my afternoon schedule and go into the field. So I like the relationships that I had with regular clients and regular barns. And I had clients in Vermont that have been hundreds of them that were with me for almost 22 years. So I had great fond memories of working in Vermont and the people over there. So I would say that I split it sort of 50-50, but my passion of seeing horses in the barn has always been there.
That's really cool. And I mean, I know you saying that you're like, you have these connections with your clients, and we even have a Ride IQ member today who posted in our group being like, Dr. Phil is the absolute best. Like, he's a total savior. So even from our subset of the community, you already have a lot of fans. So it's really cool to see. A question that we got a lot of kind of subsequent questions around is, the starting point is the question, what are the essential items that every horse owner should have in their emergency kit?
So I think that what is important for them to have, in my opinion, a minimum would probably be a thermometer, bandage material, and probably a tube of Banamine paste. I would start there. If you want to expand on that a little bit, you can add, for example, some eye saline lavage solution for the horse's eyes, maybe a stethoscope, and you sort of can build, bandage material and different things from there. But I would probably say that would sort of be a bare minimum.
That's helpful. And Jane, one of our members, was wondering, does your answer change at all with the knowledge that somebody lives over an hour away from a vet?
Yeah, I mean, if someone lives pretty far, and let's say your horse has some pre-existing conditions that might flare up when you're not there, or there's some things that might be repeats, those are situations where that client veterinarian relationship comes into play, right? Normally we wouldn't leave antibiotics with people until we have a diagnosis, or we might not leave certain type of medications. But once you have that rapport, you understand the horses that they have and the scenarios that might come up, you might expand a little bit what you're willing to work with those people. So it's not a black and white answer, it is fluid.
Yeah, I mean, that makes perfect sense. It totally is like horse by horse basis on kind of what's required or what's necessary. Ashley is wondering if there are any uncommon items that you wish as a vet horse owners would stock in their emergency kit. She's wondering if there's things that they should have on hand but often don't, but that would be helpful.
I think those items that I mentioned are going to be the main ones. I think the undervalued one is the thermometer, because and if one piece of advice that I would like horse owners to know today, Banamine is a very common medication we give to horses, and it's a phenomenally powerful medication. And horses are pros at hiding infections. Horses can have a lethal infection and show you no fever and have a normal white blood cell count on blood work and still have something serious going on. But there are certain things, for example, a horse can have a type of colic that's called, like small intestinal enteritis, for example. And that's a pretty severe colic. And a lot of times they'll run a fever, but then owners will give a tube of Banamine before we get there. And that will take the fever away for 12 hours. And when we do our exam and someone never took a temperature, then we have to make a decision whether a horse should go to surgery or not sometimes. But in almost 30 years in this profession, I've never taken a colicky horse with a fever to surgery before. It's sort of not recommended. But now you can imagine someone will give a dose of Banamine before talking to us. No one ever took a temperature on this horse. Now we're trying to decipher how to do or treat this very complicated case, and we don't have that piece of the puzzle. So if we're talking emergencies, don't ever give medications to horses before you talk to your veterinarian. And if you're going to use something like Banamine paste, always take a temperature before you give it.
Wow, that in and of itself, like right there, that is such a big takeaway from this conversation. Because I mean, yeah, I think a lot of people wouldn't think to do that. And it could be, and like it could totally change the outcome of how the vet's able to treat your horse. So
yeah,
really important tip there. Jane is wondering if there are any examples of incidents that owners often don't consider emergencies, but you wish they did for better potential outcomes.
I think the ones that can be tricky are the ones that don't seem like they're a big deal to begin with. I would say very often eye emergencies, right? So a horse will bump its eye, for example, but they don't realize, or they think the horse bumped its eye, and it might be the stick in the cornea, right? Or a horse might have a flare-up of uveitis, which is an inflammation of the eye, or moon blindness, we call it as well. And then they look at it and they say like, well, it's Friday, I'll probably give the vet a call on Monday. And now they fall behind the 8 ball, right? The other thing that I see sometimes, horses can get puncture wounds. So punctures is basically if something stabs the horse, goes through the skin and comes right back out again. And you can't see it, or it's a very small laceration. But if that happens over a joint or a tendon sheet, for example, it's just enough to seed infection into a very important structure. And if that goes unnoticed for a while, you could potentially have a life-threatening condition with those horses. So yes, there are scenarios where you don't think much about it, and it could be more serious than you think. Another one that I can think of the top of my head is sometimes a horse can choke, for example. And there's a difference between choke in people where you can't breathe versus a choke in horses where you can't swallow. And then they find these horses and they're choked and there's food coming out of their nose and they're a complete mess. But by the time the owners find them, they realize, okay, the horse is not choked anymore. But they don't think about the fact that a lot of that food might have gone down to the horse's lungs and pretty much setting them up for pneumonia. So if we don't get contacted or they wait too long to call us, now we have a horse that is sick with a lung infection that could have been prevented if we had known before that the horse had a choke episode. So it's one of those, if in doubt, I'd rather, as a veterinarian, get a phone call that I can just talk to someone than to have something important that goes missed.
Absolutely. And okay, so all three of these topics that you just touched on are ones that I want to dive into more on this session. Before we do that, we got some miscellaneous ones that I wasn't sure how to kind of categorize them. Caitlin is wondering about mast cell tumors. Any experience with advice or resources for owners suddenly experience a horse with one?
Okay, so mast cell tumors, the good news is that mast cell tumors in dogs are very lethal. You know, we have heard before of a dog getting it on their legs and they have to amputate the leg to save the dog. The nice thing in mast cell tumors in horses behave very differently, and they're not the life-threatening kind of tumors in horses. And sometimes they have an inflammatory component to them. And we have had them before, especially around eyes. I've seen them where sometimes we have injected like a steroid, like triamcinolone, and we have been able to reseed those masses or sort of calm them down. And in certain circumstances, if they're not too big, you could potentially do a resection, right? Try to remove most of the mass. So the chances of a mast cell tumor really spreading through the whole body, like a metastasis in a dog, is very unlikely. So there are some new therapies that can be used, sometimes a steroid injection or removal of the mass. But the main message of mast cell tumors in dogs, in horses, is that they don't have the implications that they do in dogs.
Wow, yeah, that is. I was kind of when you said there's good news, then it said it's normally terminal for dogs. I was like, where's the good news?
Yes,
but
it's the same
that
thing.
Is good news. Yeah,
it's the same thing with melanomas, right? I mean, in people, a small, tiny melanoma is very concerning. Horses, if you look under their tails or their sheets, they'll have quite a bit of melanoma at times, but the chances of losing a horse to melanoma is very low, despite them potentially having fairly high numbers of them.
Wow. Yeah. Super interesting. Okay. Taylor is asking, what is the current best practice for a horse experiencing azoturia?
Azoturia.
Azoturia.
Azoturia. Okay, I'm with you.
Sorry, my pronunciations are.
No. I had to think for a second there. Sorry about that. What happens, I think she's referring to something also called azotemia. And azotemia is when the kidney function can be partially compromised, and then the kidney function goes down a little bit. Primary kidney disease in horses is not very likely, and sometimes if you give too many non-steroidal anti-inflammatories, for example, you give too much phenylbutazone or too much other anti-inflammatories, it can lead to an intermittent kidney function problem. But sometimes if that's detected early, you can sort of dilute the horse with fluids again and try to get kidney function back again. But that's probably what she's referring to. But this is something where blood work and a more advanced workup will get you better information. It's more of an internal medicine type case.
Really, really great to have that information. Okay, so I'm going to dive into some of these like more categories of equine emergencies. And let's start with colic. What are the signs and symptoms of colic that a horse owner should be looking out for?
So colic is by far, it's the number one emergency in horses. And it's also, despite all the technology that we have nowadays, it's still the number one reasons that it's still the number one killer of horses. So it's a serious condition. The one thing I want to tell some people is that the other thing that colic represents sometimes in really old horses is that it's the way that they eventually will pass away naturally. So we used to have these older Morgan horses in Vermont, and then you get to the point that they're 30 years old, 31 years old. They've sort of been part of a family their whole lives. Then you get that call at 10 p.m. on January when it's 20 below zero, and you go see these horses, and they severe colic, right? And it's a 30-year-old horse. And then people say, oh my gosh, what do I do? What can I do for treatment? Do I need to go to surgery? But the horse is 30 years old, and the owners really panic and feel helpless. And then I have to remind sometimes people, hey, when these horses get older, as we all know, horses don't die in their sleep, right? It's always dramatic how they go. But in these older horses, I used to call that the final colic, and it's okay for those owners to accept that. This is just a natural way that your older horse eventually will die. Now, going back to colic in younger horses, those we are supposed to save as many as we can. And I say flank watching, trying to roll, Fleming, when they lift their upper lip, that can be a sign of pain, up and down, biting at their flanks, sort of stretching out in the stall. Those are all different signs of colic. So basically, if they're having behaviors that you would say, my horse normally doesn't do this, and that you're just restless and you can't associate it with anything else, there is a good chance that those could be signs of colic.
And when should a horse owner call the vet if they suspect their horse has colic?
So that's a two-part question. Okay, so this is going to come down to if you are new to horses, you're not very comfortable with the medical side of horses or management of horses, then I think that if you suspect it, you should call your vet no matter what and just say, hey, this is what's going on. This is what my horse is doing. And then your veterinarian might say, okay, I'm not too worried about it. Keep an eye on it for an hour. Or if it gets worse, give me a call back or let's check in again. And then you're going to have, the barn manager that has been around horses since they were young. They have 30 years of experience. They've been running a dressage barn, for example, and they know a lot about horses. They might see a very mild case and just tell someone, hey, let's pull the food out of the horse's stall. Let's go hand walk this horse in the arena for 15, 20 minutes, and then put it back in the stall and see how it's doing, right? And those people might be more comfortable sometimes using a stethoscope and taking a temperature or listening to for heart rate, gut sounds, and get a temperature on the horse. And if that's all normal and the horse settled down, that it might be okay not to give us a call. And they might also realize at some point that the case is not getting better, and then they'll give us a call eventually. So I do think that the level of experience and comfort with your horse plays a role in that answer. But if you're unsure, calling the veterinarian is always going to be the default thing to go to at that point.
Got it. And at what point with colic is it safe to manage at home versus it recommended to ship into a hospital for monitoring or intervention?
There's a couple scenarios that play into that. I think that the full workup that is done on the farm is important, and we do have some really great new diagnostics we can use now. There's something called lactate. So we can measure if there is intestinal compromise with a blood sample on horses. And that is something that has changed over the past 10 years that has made some of those decisions significantly better. But for example, if you have a mild colic, we don't feel that there's anything major, or it's a mild to medium colic, but you own a trailer, right? And you are 20 minutes away from a surgical table. And if things don't go well, you can load that horse and go. Then you're a little bit more brazen about keeping some of those horses on the farm, for example. But if you're in a scenario where it's a emotionally or financial valuable horse, you are 2 to 3 hours away from a surgical facility. For example, you don't own a trailer and you have to go find a trailer if things are not going well. And especially if the horse is insured and an unnecessary trip, they can treat it medically and then ship it back in a couple of days can be done. Then sometimes we might lean on the safe side and do this unnecessary trip potentially to a vet clinic and then treat it medically and send it back. So you have to evaluate the situation that you're in to make those calls. But it's always going to come down to the examination originally.
Yeah, I mean, that makes perfect sense. It's a totally reasonable guideline. And I think it's really clear in what time or what scenario that you're in. Okay, so that's for colic. Eye injuries. What are some common causes of eye injuries, and how can they be prevented?
So people don't realize this, but eye problems is a top 5 emergency in horses. And the reason for it is that if horses have these very big eyes and they're very delicate and they protrude out of the head, right? Because they can see almost all the way to their backs, right? They have almost 180 degrees worth of vision. And because of that, they stick off their heads. But it also makes them very prone to bumping them. So very often when they bump their heads, they're going to bump their eyes. So that is sort of what sets them up. So trauma is a big one. I don't know. I probably have stitched up over 100 eyelid lacerations. That's how common they hit their heads. Sometimes they can get a corneal ulcer. That is a very common problem, and that's definitely one that you want to jump right on top of it. They can also have moon blindness or uveitis, which is sort of an allergic reaction of the eye or asthma of the eye type of deal that needs to be treated sometimes with topical steroids. And they also can get foreign bodies, right? They can get a little splinter in their eye or stuck in their eyelid, or they can get a big swelling from that. So those are common things that they will do. If we're going to talk about being careful with medications here as well. So if you have an eye ulcer, you will treat those horses very often with an antibiotic ointment because you're trying to kill the bacteria that are sort of festering the ulcer. But if you have moon blindness, you will probably use an antibiotic plus a steroid because you're trying to calm the eye down. For example, if someone has an eye problem, they don't know what it is, and an owner decides to use an ointment they have sitting around and that happens to have a steroid in it, and now you have an ulcer, now you suddenly told the body to back off from that ulcer healing because of the steroid, and you're setting this horse back several days. So it also goes back to, just because you have an eye ointment and you have a new emergency, do not start treating it. Call the veterinarian first because you could be giving the wrong medication.
Yeah. Oh man. I mean, yeah, given the structure of the eyes on the horses, I am honestly kind of surprised I don't see more. Like, I'm sure you see a lot just in your line of work, but kind of surprised I don't see more issues in the eyes.
Yes.
When, I guess you kind of just answered this, but is there a more specific answer as to when a horse owner should call the vet if they suspect that they suspect an eye injury? Is it any time that they suspect an eye injury?
Pretty much. I mean, sometimes they can bump their eye and sort of just swell some of the area above of the upper eyelid or above the eyelid. But if you can look at the cornea and it looks good and the eyelids themselves are not swollen, it's just a little swelling around the eye, that is something to be okay. But if it's really the eyelids are swollen and you can see the conjunctiva or there's anything going on with the cornea, I would call on those, because it is not only does it take a long time to treat those problems, horses hate eye ointment in their eyes. And if you're stuck doing that for a couple of weeks, they're going to hate you even more. So if we can jump on these and get rid of them right away with minimal treatment, that will benefit everybody.
Are there any immediate steps that owners should take aside from calling the vet when they have an eye injury? Is it like they should be flushing it out with water? Is there anything like that, or like cold press or anything?
You can cold press. You can cold press. You might, when you call the veterinarian and you have Banamine laying around, they might tell you go ahead and give a dose. And then remember, got to take that temperature first, right? And then the other thing too, to use eye specific saline, so an eye solution that's made specifically for eyes. You can buy a big bottle at Walmart. It's okay to rinse the eye with that. So if someone wanted to rinse the eye, I would just don't use plain water. It has to be a physiologic solution to protect the cornea on the horse.
Wonderful. Are eyelid injuries less of an emergency than eyeball injuries?
No, because sometimes they can jokingly almost fillet the eyelids. And it's like, I had a horse one time that he ripped off almost 90% of the upper eyelid. It was hanging. And for some reason, horses' heads healed really well. And we stitched that back, even though there was a tiny piece holding on still. And we saved the whole eyelid on this horse. And that surface of the eyelid that touches the cornea is very, very delicate. And if you were to lose a part of the eyelid, it will now create almost like a bad windshield wiper, that leaves a streak. It's going to start scratching the cornea. So when they cut their eyelids, we want to stitch it right away to heal it as well as we can, so that the cornea doesn't become the second insult of that eyelid laceration.
Wow. That sounds absolutely gnarly. You said, so don't just go and apply any eye medication that you have, but is there anything else that you shouldn't do when you notice an eye injury or eye discomfort with your horse?
I probably would wait for the veterinarian, or at least discuss with the veterinarian. The nice thing that is so different when I became a veterinarian to now is we have these little thing called iPhones in our pockets, right? Back in the day, you just get the phone call and they're trying to describe it to you. Nowadays, you guys can take pictures, you can text it or email it to us, and we can see right away sort of what's going on and give you some better advice over the phone. But as far as eyes go, it's either, some cold compressing, maybe a little bit of saline, but other than that, I think if you're going to do anything, it needs to be under the guidance of a veterinarian.
Absolutely. Okay, so do you feel like that covers eye injuries? Is there anything else on the topic of eye injury that you want to dive into?
I don't think so. I think that should cover it.
Awesome. Choke. Can you previewed this a bit at the beginning, but can you tell us a bit more about what is choke?
Yes. So choke is basically, when a horse swallows the food will go from your mouth into your esophagus, which is basically the pipe that will connect your mouth to your stomach. And horses will choke when they swallow food that they cannot, get all the way into their stomach, and it gets stuck halfway down their neck. And then they just cannot push it down into it. And then horses produce a lot of saliva because they have to, can you imagine if you're eating all that dry hay? There's a lot of saliva to wetten that to be able to swallow it. And what happens then is they try to swallow the saliva that they're still producing, but because there's an obstruction in the esophagus, it cannot go down, and then it will start to come out of the horse's nose. And then you will actually see saliva pouring out of their nose or mixed with grain or with hay. And that's because the esophagus is completely obstructed. Very common causes for that. Sometimes if horses have bad dentition or they haven't had good dental care, they're not chewing their hay appropriately and it's too stemmy, and not fine enough to swallow. And then the big one in Vermont where I practice is they really liked feeding beet pulp to horses, and then they would mix it with water and not let it set out completely. So then it was partially set out, and then horses would swallow a larger amount and it would get stuck in their esophagus. And then when it couldn't go down, it would continue to expand, and then it would be like a cork in there. And we had some of those that it would take almost a couple hours to relieve the obstruction on those horses. Yeah.
Wow.
So the problem that we have is if a horse cannot swallow, it will dehydrate very quickly because they will lose saliva, which dehydrates them, and they don't have the ability to drink water. So that's one thing. And then the other component of the disease is that these horses will now have food coming out of their noses, and when they lift their heads or they're trying to swallow, that will go down into their lungs, and then it will create pneumonia. So these horses will very often need to go on antibiotics as a preventative care after relieving the choke as well.
Is the first signal that you could possibly know a choke was happening is the saliva coming out of their nose? Is there anything else to look for?
And retching. They'll stretch their heads out. They try to cough a little bit, and you can see them trying to swallow. They stretch their necks out, and then they tense their necks very hard, and it's trying to you can see them coughing, retching, shaking their head, and they're trying to swallow it. And that's the initial response. And after a while, if they just can't do it, they calm down a little bit more, and then you will see the stuff starting to pour out their noses.
Oh man. Is choke always an emergency?
Yeah, the thing that happens sometimes is I would probably say that 50% of chokes, horses will relieve it on their own. So sometimes when we're driving there, they get better. But we end up always still going to the call because we want to do an exam on these horses and see if they don't need to be on antibiotics. And in some of those chokes, they can sort of really injure the inside lining of the esophagus. There's a mucosal lining, and that can get really irritated. So then we have to put them on soft food and sometimes anti-inflammatories as well to allow that to heal and not let it swell too much. So just because they resolve their choke, it doesn't mean that they still don't need more care.
Is there anything the owner should be doing while waiting for the vet to arrive?
I would just keep the horse in a stall, calm, take food and water away, and just let them wait until the horse owner gets there. The one thing I've had people try to do is try to stick a hose in their mouth to try to flush it down. And all you end up doing is pushing even more food and water down the lungs. And then you are actually the one causing the pneumonia on those horses. So don't try to wash anything down on these horses. Just wait for the veterinarian to get there because we have to pass a tube down the nose and start lavaging it out to try to relieve it. But what we do with these horses is we sedate them so heavily that, normally their heads are up. So when we sedate them, we pass a tube, we let their heads hang all the way to the floor. So we angle the esophagus and the trachea down. So when we wash things out, it cannot go to the lungs. So we change the mechanical angle of their necks to prevent that from happening.
That makes perfect sense. Very reasonable. Okay, does that cover choke for you? Is there anything else you want to note on choke?
No, I think so. I think, keep them calm, call your veterinarian, the risk of pneumonia, and also, knowing that it might resolve on its own, but it still needs aftercare. So I think that covers most of it.
Cool. Lacerations.
Yes.
How do we know if a wound needs emergency evaluation or sutures?
So Lacerations is one of my favorite topics as a surgeon. Love to stitch things, right? That's what we do. Um, there are lacerations that need to be sutured, and then there's partial lacerations or superficial lacerations that might not need sutures. Um, the the important thing is to know where the laceration has occurred, right? Again, if it was over a joint or a tendon sheet, you could be in deep trouble. That needs to be seen. I've had sometimes, on the side of the cannon bone, sometimes you will see a big sort of like partial thickness or sort of a small laceration and some banged up skin. And then people say like, oh, it doesn't look too bad. And then we come back a few days later and there's a big bump and it actually broke their splint bones, for example, and it went unnoticed, right? So, and then the other thing too, there's something called the golden rule. If a horse cuts its skin and we are able as veterinarians to get to that wound within 2 hours and clean it and suture it, the chances of that suture line healing well on the first go around is significantly higher if we do it within 2 hours than if we wait more than 2 hours. So, so again, if you have a problem, this would probably be one of those that I would reach out to your veterinarian. This is a great situation where you can take pictures, right, and send it to your vet. And sometimes I've had it before. People call me, it looks kind of ugly, and we say, yeah, I think you'll be all right. Don't worry about it. And then we've had some that look like a tiny little puncture, and you go like, oh, that's actually a fairly, significant problem, and we should come out and see it.
Wow. When it's a tiny little puncture, like what are you looking out for? Like, I'm sure those could probably be pretty easy to miss.
They can be pretty easy to miss. And the best example I can give is, if you remember the little erasers we had in school to wipe the stuff off. Now imagine if you grabbed a needle and you punctured into that eraser and you pulled the needle out. Can you ever find that hole again? You can't, right? So that's what happens sometimes with horses. They can get a puncture or something go into a joint and it just seeds the bacteria in there and comes out. So, location is sort of key with all of this. So sometimes you can have something that looks very innocent, let's say on the front of the cannon bone, on the horse's butt or their neck, and we're like, oh, I'm not worried about it. If we see that exact same thing on the front of the knee, the front of the hock, right over the pastern region where there's a big tendon sheet running right there, we might go, hey, we got to come out and have a look at it.
Got it. Okay. So kind of the plan of attack for the owner is, first of all, like find the puncture wound, identify where it is,
Yes.
probably send a photo to the vet, and then kind of what do you recommend they do next?
What we recommend to do next, if you need sutures or there's over a synovial structure that we would call, we need to come out. And if not, we might tell you, hey, just gently wash that area with some, mild soap and water, and then maybe clip a little bit of hair and put like a standing wrap on those horses. And if we don't think an infection is a component, we might tell you to give it some butobanamine to get the swelling down. And then we'll tell you, hey, give me a call tomorrow. Let me know how things are looking. And if things are starting to look a lot better, then we sort of go from there. And if things start to go the other way, then there can always be a second follow-up call, and then we might come out at that point in time. I do think, again, that this is sort of like colic, where you're going to have barn managers that have dealt with all of these their whole lives. And if you have someone like that, or someone who is a career horse person, they might go and say like, hey, I'm worried about this one. Or they might also go say like, hey, you know what? I think you'll be okay. Maybe check with the vet just in case. So sometimes having an experienced person there to sort of look it over might not be a bad idea.
Absolutely. Yeah, barn managers can really be so helpful in these scenarios. Okay, so that is really helpful for lacerations. Do you feel good about the covering of that topic?
I think so. I think that sometimes the biggest lesson with the laceration is not to underestimate that a very small cut in a really bad location can be a big problem. The one story that I have about this is we used to have these 4-H quiz bowls at my clinic, and we would have, these young kids do it, but was this young lady, she was about 10 years old, right? And she would always come to the quiz bowl, and she loved horses. And then one day I get a phone call from her father, and he said, hey, I got a situation with my daughter's horse, and the horse stepped on a nail. And, my daughter's freaking out because I want to pull the nail and she won't let me do it. And she said, Dad, I learned that you're supposed to leave the nail in for the veterinarian. And he's like, she's overreacting. And I said to him, she's not overreacting. She paid attention in 4-H, and she learned the lesson that once you pull that nail, I don't know the severity of this problem. And what she's telling you is actually the right thing. I'll be right there. So we went out, took an X-ray, and it was okay. So then later, I explained to the father why she was being so defensive about pulling the nail, and then he realized, and then he felt horrible, and then he had to apologize to her and do everything. But that was one of those scenarios where, she had educated herself, she knew what the right thing to do was, and she stood her ground.
That's amazing. I'm sure whatever she's doing, I'm sure she's successful, because
yes,
she sounds like a go-getter. Okay. Kind of off the topic of lacerations, lameness and injuries. How can horse owners distinguish between minor and serious lameness issues?
This is one that can get tricky a little bit too. I would probably say that the number one orthopedic emergency is going to be a foot abscess, right? So if you have your horse, he was in the stall, you brought him in, and then after a while they come out of the stall, you don't see any swelling on the leg, everything else looks normal. They're really reluctant to put their foot down, or they're trying to float the heel or float the toe. There's a good chance that could be a foot abscess, right? And there's some things we can do for that, because if we can go out and find a pocket of pus and open that, it can relieve their pain almost instantaneously. But you might also have horses that are older and arthritic, for example, right? Or horses that have sore hocks, and if they got up from sleeping all night and is a school horse, for example, they might get some soreness, right? So when they walk out of the stall, they're a little bit stiff. But for example, if their heart rate is normal and they're acting normal otherwise, but they just sort of tender at the trot or the canter, then that is something that can probably wait. But usually if horses start to elicit lameness at the walk, that is when I'm worried about things. Because a horse, if it's not too painful, they can still walk normal. But when they're sore at the walk, then I think a veterinarian should see it. The other thing I think is situations, for example, if a horse is sort of tender, where you see a big swollen tendon, for example, like a bow tendon, that is something that needs immediate attention as well. Because sometimes when they bow their tendon, that injury continues to create damage over time. And you might have seen multiple times in your career as well that will put their legs in ice buckets, right? We're trying to ice the whole system down to try to stop the furthering of that injury. So that is something that should be seen. But traditionally, remember that foot abscesses are the number one cause of, acute lameness in the horse, which is usually something that's very treatable. But then if they're only a little bit lame at the trot or the canter, that's probably something that can wait. But if they're pretty lame at the walk, they should probably be seen.
Got it. And when you feel pretty confident, when your horse is three-legged lame, is that always warrant calling the vet? Or if you're like pretty confident it's an abscess, you start treating the abscess, or call the vet? Kind of what's your...
Well, it depends a little bit, right? So again, take that temperature, right? And if you have someone who's very comfortable with horses, they might use a stethoscope and get a heart rate, because horses will indicate their level of pain based on their heart rates. It's very reliable. So horses' heart rate should be less than 40 to 44 beats per minute. So if you have a horse with a heart rate of 60, 72, that means that there's something more serious. But if you have a horse that looks like an abscess, you palpate the front of the hoof and it's hot, you might have a pair of hoof testers laying around, and the barn manager or the professional knows how to hoof test, and they press on the toe and it's very, very sore, you know what I mean? Then sometimes over the phone call, you might see it's very likely an abscess, and then you can start, soaking the foot and wrapping the foot with Ictamol or, whatever material you're comfortable with, and then sort of get ahead of things that way.
Got it. What are the first steps to take when a horse becomes suddenly lame?
I think that to just calmly get that horse into a stall so you can sort of contain them at that point. Because there are other situations too. People sometimes think a horse might be lame, but the horse might be tying up severely. And if you keep moving that horse too much, you can further the tying up. And if they get really bad with tying up, there is, they can accumulate myoglobin in their blood, and they can pee really dark urine, and it can lead to kidney failure. So that's a horse that we have to treat with IV fluids. There are scenarios that there might be something deeper than what you think it might be. So a three-legged lame horse, unless it's an abscess that's easily recognized, I think that veterinary assistance is definitely recommended in those scenarios. But
And
to
if
keep
they're
these horses calm, that's the main thing. Sorry, but put them in, it might be, and if we're on our way, you can put them, on cross ties and keep them calm, or you can put them in a stall and keep them calm. But I would not leave them out in a round pen or have other horses chasing them. I think I would sort of protect them and keep them quiet.
Got it. And if it's not like a three-legged lame situation, it's just like a more minor lameness, is that still your recommended plan of attack?
I would, yes, because there's something that's not making this horse very comfortable. And, and if it is something mild, or you saw that horse, his hocks are sore, or, it's an ongoing, horses that, are just foot sore, those type of things, you can always give that horse maybe a tiny little bit of bute, if you're comfortable, just for one dose to bridge it over until we can come out the next day. But again, if you are in doubt, just give us a ring. Yeah.
Yeah, I think sometimes it's like hard to not want to like inconvenience your vet and to be calling them at all hours of the day. But in a lot of these cases, like they are kind of they should be your first call. I don't know, there's a balance.
Yeah, but I always felt that, and the other thing to remember, we're talking emergencies in general, right? And the one thing that we worry as veterinarians is every disease has that one scenario, right? So if you make a generalization on something and it happens to be that one scenario and it goes wrong, then you're in trouble, right? And that's what we're sort of trying to avoid. But if you have a veterinary patient-client relationship, I had people that would call me and say like, hey, buddy that I've known for 20 years is doing this. And it's like, okay, that's the 5th time he's doing it, right? We know what it is. Go ahead and do this. Go ahead and do that. So many times when we get these phone calls, it might be a case that we're already familiar with. We know what that horse historically has done, or we know that horse really well. And then we might be able to avoid a call, just because there's a knowledge and a comfort level with that case already. But if you're dealing with a horse you have never seen, you don't know how that horse behaves, or it's a new client, then it's better to have a discussion about it, because it's one of those, if we don't come out and it's serious, then everybody's upset. If it's a phone call and say like, hey, you know what, it's not that bad, don't worry about it, I can see it tomorrow morning, then everybody's happy, right?
Yeah, totally. Okay, that is lameness and injuries. Is there anything else on that topic that you feel like we should cover?
I don't think so. I think lameness in itself is probably a 3-hour discussion. So I think that, as the generalities go, I think that covers the sort of the decision-making process at least.
Yeah, no, absolutely. Yeah, there is so much more we could dive into on each of these for sure. Respiratory distress. What are some signs of respiratory distress?
So if a horse has a respiratory problem, it's going to be coughing, heaving, right? Heaving is when they're chest breathing, nasal discharge, and very often a fever if it's an infectious disease. So older horses can get, as a general term, asthma, and they can sort of have very increased respiratory rates, and that's not an infectious process. And those horses very often might need steroids, or bronchodilators to try to, like an asthmatic person, to try to breathe better or easier. The one that we worry always about is the infectious causes of disease that cause respiratory problems. And, there's some big ones in there. Strangles, equine herpes virus, and the flu would probably be the more common ones. There's a couple new ones coming up these days. Equine rhinitis B is another one that is starting to surface a little bit. But for example, if a horse has the flu or herpes virus, or especially strangles, those horses need to be identified early and separated from the herd and quarantined. Because if we don't do that, we can have a whole barn that has a problem after a while. And if this happens during show season, it can shut down an entire operation and keep people from going to shows.
What are immediate actions that should be taken if a horse is having difficulty breathing?
I think that if they're having an asthma attack, there's not much you can do on the farm. And, again, just take the horse to stall, keep him nice and calm. And then we have to use medications on those horses to sort of bronchodilate those horses. If they have, nasal discharge, or you think there's something else going on, again, keep them, separated from the other horses and take their temperature. And if they have a fever, there's a very high likelihood that they have an infectious problem, and if that's the case, then we need to come out, examine the horse, and then get samples and submit those for diagnostic testing, because it's very important to know what the organism is, to have an idea of the level of infectiousness they're going to be dealing with and how we need to contain the problem. But the one thing with infectious respiratory disease in horses is vaccination is a really big preventative for that. So to make sure that horses are properly vaccinated on a regular schedule, at least twice a year, for make sure that they're covered for strangles if that's a risk area, but especially the equine flu and herpes virus is very important, because that makes a big difference in preventing outbreaks.
Really, really helpful. Okay, so this one is relevant to all of our members and friends in Florida right now. For areas that experience hurricanes, flooding, fires, or blizzards, you had recommendations for preparations that could help in the case of weather emergencies?
I think that that's going to have to do with your topography, right? I mean, if you're in a low-lying area where the pasture and the stall are going to flood, then you should probably move that horse, right? I think that if you are in an area that runs out of power on a regular basis, you might want to have, nice clean water in buckets available so that you can make sure that these horses have water. Sometimes with wind and branches breaking in the pastures, you might have to keep an eye on that, to make sure that maybe they should be in the stall, if they're in a very wooded area. So I think this is probably one of those that there's a lot of scenarios to cover, but I would think common sense is the key on those. And then just make sure that you check on those animals, The one big one that we always had to deal with was always 4th of July, right? When your neighbor is, a firework nut and they just go crazy on it, and that to maybe go talk to them. And I've even had clients that had to move their horses for 4th of July because the neighbors were going to have a big party and they refused not to shoot them out, and the horses would freak out, and then you have to go ahead and do something to prevent the problem. But I think prevention and just thinking about things that's going to happen is the key into just trying to mitigate those.
Yeah, man, the fireworks thing. I really hope that the world just moves towards like the drone shows. Like if we really need that, like let's just the drones are so quiet and they're cool. I don't know. Yeah, so that is great. A great point with that, with the 4th of July. Okay, what are some common mistakes that horse owners make during an emergency that you've experienced in your career?
I think that, again, when they start medicating themselves, and I call them the Dr. Google clients, right? So they have a problem, they go online, they look it up, and then they convince themselves that it's a specific condition, and they start treating it themselves, and then they miss the diagnosis. And now we're down the road with this, and we have a much bigger problem. And in horses, more than any other species, if you have an early diagnosis and you treat something early, the outcome and the success rate is significantly higher than if you fall behind the 8 ball. So I always go back to, even with a colic, right? You can have a colic, for example, a horse that has a lipoma and has 20 feet of dead intestine, right? If that horse gets to a hospital 3 hours earlier, the difference between having to remove 20 feet of intestine or having a dead horse and having a live horse is incredible, right? So it's like cancer. If you find out in the very early stages you have cancer, there's so much they can do, right? But if you've never got a colonoscopy and now you're riddled with cancer, now they're just playing from behind and just trying to maintain you. And there's no better example in horses than to just get an accurate diagnosis on time and get the right treatment. And that is invaluable, because I think that the biggest problem that we have is people think they know what they're doing. They're worried about money, right? That's the other one. And then they say well, let me see if it gets better on their own. And when this thing goes too far down the road, sometimes it's irreversible.
Yeah, no, that makes perfect sense. Okay, have there been any advancements in veterinary technology that have improved the management of equine emergencies in like the recent history?
Yes, big time actually. So when I started to go to vet school, the biggest thing that had changed in horses for a long time was the advent of safe anesthesia, right? Anesthetizing a horse safely to be able to cut a colic, because 40 years ago, the horse would barely survive anesthesia. So the biggest improvement we had over those years was we can now anesthetize the horse very safely, for 2 or 3 hours, and do arthroscopy, do a colic surgery, whatever you need to do. And that was the biggest advancement we had. And then after a while, things were sort of the same. And then in the last 15 years, we went from, having to dip film in tanks to having these wonderful digital x-rays that can come right to the stall of the horse in the barn, and we can have high quality x-rays. We have digital ultrasounds nowadays that provide incredible images, and we can get really good studies done. And also the latest thing that is really coming around right now is called stall side diagnostics for lab work. So again, we talked about the colics earlier, the lactometers. You can run a lactate on these horses within a minute of getting there and assessing a colic, and they can really help make big decisions on treatment. And then the other one I can think of is serum amyloid A. We talk about horses being very good about hiding infections, right? So they can have a very big infection, have no fevers, have a normal white blood cell count, and they would use to confuse us. But this SAA testing will give us a different aspect of numbers we can look at and determine if these horses have more severe infections or not. So I think imaging is a big component of this, and also the stall side blood work diagnostics have made big improvements in how we can handle emergencies.
That's really cool. It's great to hear like those are just such tangible, like, man, like that's a huge, like the outcomes are so different with
Yes.
with the invention of those tools. Okay, I mean, we're here, like we're basically here on the hour, and thank you like so much for sharing your expertise with us. This has been so insightful. Do you have any final advice that you would like to give to horse owners to help them feel more confident and prepared in handling equine emergencies?
So the one thing I think horse owners should know how to do is to get what we call a basic TPR. I would grab a cheap stethoscope on Amazon. They're not that expensive. Have a good thermometer and learn how to get a heart rate on a horse, how to get a respiratory rate on a horse, and to get a temperature on a horse. And if you wanted to really go crazy, learn how to listen for gut sounds. But those are numbers that can be invaluable when you're dealing with an emergency. So if you can call us as a veterinarian and say, hey, my horse is acting a little colicky, but his respiratory rate is normal, his heart rate is 40, and he's not running a fever, just takes the pressure out of the whole thing, right? So I loved it when clients had learned how to do TPRs on their horses. And there was a lot of these young folks back in the day, when we used to do those 4-H quiz bowls, and show them how to do stuff. And we would teach them. And once you know how to do that, that's a lifetime skill that they can have. And if you're dealing with horses on a regular basis, that's a very important skill that can help you.
Absolutely. How can horse owners stay updated on best practices and advancements in equine emergency care?
Well, I think one of the things they're already doing is they joined the Ride IQ platform, right? And in addition to that, I do think that, there's a lot of resources in magazines like the Horse Magazine. They will write articles. They're in association with the AAEP, and I write for those, and my teammates write for those, and we try to cover all the different topics. And I think there's websites and podcasts that they can go to as well. I do know the company that I work for, Merck Animal Health, they sponsored the Disease du Jour podcast that talks about disease processes as well. But I think that folks like you guys, that are trying to bring all this information in a nice, concise package to an audience is probably one of the best ways that they can get this.
Amazing. Well, you heard it here first, folks. Dr. Phil, thank you so much for spending this time with us. We hope that we can find a lot more ways to learn from you, because your extensive knowledge on the topic of equine veterinary care is so valuable, and we just really appreciate you taking the time and answering our questions tonight.
Oh, no problem. Had a good time. Thank you for having me.
Wonderful. Everybody who attended live, thank you so much for doing so, and I hope you have a wonderful evening. Bye, guys.